about the psychiatric community? Are they? You find that this is going to be a trend where you begin, prescribing or recommending it for, anxiety, depression, some of the ADDH, even ADDH in children?
Absolutely, because first of all, I certainly prescribe it for children for ADHD and for autism. Certain kinds of autistic children, the ones who are so throw things around and have so many violent episodes at school, they're kicked out and a non-community. These kids may get enormous relief from some of the symptoms, particularly violence, and they become even a little more communicative and so forth. There's no question. There are some people who are very angry at me. What, you even want children to use? I don't want children to use it. I want children to have what I think might be one of the best and least toxic medicines for them. But it will be used in the future regularly in children.
You're listening to Planet Green Trees. The call number is 1-347-326-9626. We are on the phone with just one of the most fascinating people. And I got to tell you, I remember when I was, it was always, as a criminal defense lawyer, I defended, marijuana kids, and I have my own personal beliefs on certain things, not much different than actually very similar to everything you're saying. But the point that I was making is I remember seeing some of these documentaries back then, and they're going through explaining these things, and they're telling it as it is. And you were always in all these as such a, voice of reason from a scientific point, and just laying it out there. And I just remember being so motivating. And I know people that have seen you and heard you speak and read your writings are all just really moved by you. And you're just a real hero, I think, to the medical in the marijuana community in general. And I appreciate all your hard work. In the studio with us we have Michael McShane. He's been very outspoken and has spoken about his cancer and his HIV patient as well. He'd had some cancer on his face, and had surgery, had it removed via knife, and was using a topical lotion called from a Simpson oil, Rick Simpson oil, which is I'm sure you know what that is, and he maintains that it. Hey, Michael, you talk to the doctor, please.
Well, that was a good rundown, Michael. Thank you. I don't know if it was 7 years ago. Prior to, I had the squamous cell back in 4 sites on my face, and it was all surgically removed along with...
What kind of cancer was it?
It was squamous cell carcinoma.
Squamous cell carcinoma.
Yep. And so we did the Mohs surgery, which is kind of check as you go. They do cut out the obvious forms of cancer, and then they'll get some margins and check them and make sure that they're clear of cancer in a nearby lab. And they teeter back and forth in and out of surgery all day with you, which they ended up taking my lower lip off and a fair amount of my face. And I walked out of there looking like a bomb hit me. And so I had a real good plastic surgeon put me back together over the course of about a year. So I look pretty good, or at least I think so. And so it came back last year, the same exact cancer on most of the same sites. And I got a hold of a fellow that's sitting right next to me, and he gave me this Simpson oil that we had formulated and thinned it down basically into a little easier to use on the areas I'd use it on, but in olive oil basically, 50-50, and it worked. And it worked.
Well, how do you know it worked?
Because the cancer went away.
And is that confirmed by biopsy? I mean, it's gone away in the surface, but is that confirmed by biopsy?
No, because the...
well, you see, let me tell you, I don't mean to throw water on this, but, one of the things I'm concerned, I don't hesitate to recommend marijuana, even when I'm not sure it's going to be helpful, because, as physicians say, parmum non nocere, first do no harm. Now, and you're not going to, someone who's suffering from, let's say, I remember the first time I had a case of Crohn's disease, and I didn't know it would be helpful, but there were some hints in the literature, so I said to this person, look, try it. It's not going to, it was a diagnosed case of Crohn's disease. There's no question, the x-ray, all the evidence was there. I said, because he had already had a couple of surgeries for it, I said, try it. It's not going to hurt you. Well, he takes marijuana to this day. He has had no more surgeries, and he doesn't have diarrhea, he hasn't lost weight, all those things. That's great. But I would never have prescribed it for him if it were a bona fide cancer in his bowel. See, I think the people like Whit Simpson are doing potentially some people a great deal of harm, because there is no definitive proof that marijuana will cure cancer. Now, it does many things for cancer, as this paper came out just 2 weeks ago from the Israeli Association of Oncologists. And they said, they glowed very much over how useful they have found cannabis in cancer treatment, but not to treat the cancer, to treat the symptoms of cancer. Right. You know, it helps people to sleep, it helps them to get over, and all the things that it can do, it does very well. And it also is a very good anxiolytic, a substance that will cut down anxiety and depression. So there's no question it has a very big use in cancer. But you take an awful chance, in my view.
Not really.
When you say,
I don't think so.
Let me just finish, okay? Because when you say it will cure cancer, it's fine if somebody makes a self-diagnosis of cancer and thinks he's got cancer and whatever, but not somebody who's got a diagnosed glioma multiforme. You just don't do that. You go to allopathic medicine. Now, for example, there's a case that I came across just today where a person who had this brain tumor removed twice and was encouraged to use marijuana right along because of the chemotherapeutic nausea and so forth. And that's fine. But when you say, now you talk about skin cancer, there's a man I'm sure you've heard of him, Bob Mellamy. And Bob has been trying to persuade me that this will cure cancer. And the last one, he sent me all the pictures of this cancer, which seemed to clear up with this oil, this tarry-looking stuff. I said, Bob, I am persuaded that it does something with the surface of it, but you've got to give me the before surgical biopsy and the after surgery biopsy, because that's the only way anybody can be sure that this cancer is gone. Now, I know what you're talking about with squamous cell carcinoma. I had one on my back. Before anybody discovered it, had become extensive. I had to take a big swath of it out of my back. And then he called me a few days later after the path report had come back. We have to go in again. We didn't get it to we didn't get the margin outside of the lesion. So they had to go in and take a little more out. But let me tell you, I would, not what I know about cannabis now, I would never have tried to use cannabis because it might clear it up on the surface, but you don't know what's going on down below.
Well, my dermatologist does, Doc, and I've talked to him. My dermatologist does, and he's told me that even surgically, they never get it all. And in my case, they obviously didn't get it all because it came back. So to your point, I think that the likelihood of it getting it all is a whole lot better running through the bloodstream than some surgeon bobbing and weaving through my body with a knife. I just don't believe in it. I also got to tell you that I had no Blue Cross or insurance or enough tissue on my face to do any more of your work. So I think that you're wrong.
Well, and I think that you're wrong, and we're just going to have to disagree, okay?
Okay, it was, it's interesting because we've heard various stories, and of course, as you said when you began to look at cannabis the first time, how unscientific you looked at it, right? In the sense that you'd been brainwashed like everyone else until you really took a look and, saw it from a more, objective view and saw the truth in it. And you're looking the same way on this as far as its cures and methodology, not just as a treatment of a system, but you want to see some hard, fast proven. This is one of the things that I think is often complained about, even amongst doctors now that are looking to move it into their practice regularly, and seriously consider for some of these other conditions or ailments or what have you, is that they say there's not enough research at the federal government.
Well, let me interrupt you, because that's been a criticism of my work right from the beginning. We only have anecdotal evidence. Well, now we have several dozen controlled studies, but they're mostly done with Sativex, and they're on things we knew. I mean, I was talking about its usefulness in multiple sclerosis long before Sativex came. Now, they're going to test it on things that we know clinically. But, and that's one point. And these things that I'm talking about, they don't, if you mess up on a cancer, you can lose your life. And it isn't that allopathic medicine can cure every cancer, not by a long shot, but it can at least prolong life in many of them. And some of them, like pancreatic cancer, Steve Jobs got a little bit longer with his life, but there isn't much you can do. But for the most part, we are at a point where allopathic medicine has a lot to offer most cancer. Now, mind you, there are many different kinds of cancer, and each of these requires a separate protocol. To believe that there's one substance that will cure all cancer, I think is probably fanciful. And I worry about it because there are people who will take it seriously and not, you've at least seen a physician and he's monitoring, but there are people who will just say, I'm going to do it with this. I don't want to spend all the time going over this, but and finally, let me say, there may be a day, not too far away, when I have to say, yes, it will cure such and such kind of cancer. The data is there. But, and this is something we need more than just anecdotal evidence, because we need biopsy. Maybe you gotta first of all see what you've got there.
So you're sure.